We are releasing the joint investigation report into a spate of death of healthcare professionals in KwaZulu-Natal public hospitals. My name is Ricardo Mahlakanya. I'll be directing this program. And then in terms of the program, we are going to have the welcome remarks by Dr. Siyabonga Zulu, who is the Chief Executive Officer of Office of Health and Compliance. And then immediately after that, we'll have the Ombud Professor Taole Mokoena, who will be releasing the findings and the recommendations of the report, the joint investigation report into a spate of death of healthcare professionals in KwaZulu-Natal public hospitals. And then after that, we'll have the handover of the report, and the report will be handed over to the chairperson of the Parliamentary Portfolio Committee on Health, Ms. Faith Mutambi, and to the Minister of Health, Dr. Motsoaledi, OHSC Board Vice Chairperson, Ms. Sizeni Mchunu, and also HOD of KwaZulu-Natal Department of Health, Ms. Penelope Msimango. And then after that, we'll have also an opportunity for a photo session. And then after that session, we'll have remarks by the KZN Head of Department on behalf of the Provincial Department of Health, Ms. Msimango. And then we'll also have remarks on behalf of OHSC as a regulatory oversight body by Ms. Mchunu, the OHSC board chairperson. And then after that, we'll have remarks by the Minister, Dr. Motsoaledi, and then we'll afford the members of the media questions to ask questions, and also our principals will provide the answers. And after that, we'll have vote of thanks and closure. This item will be done by Dr. Siyabonga Zulu, the Executive Manager, Complaints Management and Health Ombud. And then after that, we'll have the media interviews and closure. Thank you so much, colleagues. I'm now going to hand over to Dr. Mdaweni to give us the welcome remarks. Thank you.
Thank you very much, and good morning, Program Director, Mr. Mahlakanya. Let me take this opportunity to extend warm greetings to all present here, and I wish to also welcome and acknowledge the presence of our dignitaries in this media brief, our Minister of Health, Dr. Honorable Motsoaledi, the Chairperson of the Parliamentary Portfolio Committee on Health, Honorable Ms. Faith Mutambi, the Chairperson of the Public Service Commission, Professor Somadoda Figeni, the Commissioner in KZN from Public Service Commission, Ms. Yasmin Bacchus, the Health Ombud himself, Professor Taole Mokoena, the Vice Chairperson of the Board in the Office of Health and Compliance, Ms. Sizeni Mchunu, and our board member, Mr. Simpiwe Gada. We also have a delegation led by the Acting Director General from the National Department of Health, Professor Nicholas Crisp. We also have the presence of our Deputy Director General, Hospital Services, Dr. Matabo Matebula. We have a delegation led by the Head of Department in KwaZulu-Natal Province, Ms. Penelope Msimango. We also have the Deputy Director General, Dr. Moji. There are quite a number of chief executive officers of the hospitals that are affected or mentioned in the reports. Some have joined us physically. We've got Mr. Gabriel Kaula from Prince Mshiyeni Memorial Hospital. Virtually, we are joined by the management and chief executive officers from Addington Hospital, Port Shepstone Hospital, Ngwelezane, Benedictine, and Freiheit Hospital. We also have senior managers from the Office of Health and Compliance, Public Service Commission and the Health Ombud. Indeed, in no way least, I wish to welcome the families of from the late healthcare professionals. I humbly welcome the families, the Mazwi family, the Kgaladi, Cele, the Zulu, Gidi, and Idika families, indeed members of the media. On behalf of the Office of Health and Compliance and the Health Ombud, it is my honor to welcome you to this important media briefing on the release of the joint investigation conducted with the Public Service Commission related to the deaths of healthcare professionals in public hospitals in KwaZulu-Natal province. At the outset, allow me to extend our deepest condolences to the families and colleagues of those who have passed away. They were healthcare professionals dedicated to saving lives and saving communities. The loss is profound, not only to the families, but to the communities, as well as the health sector as a whole. Today, the Health Ombud, Professor Taole Mokoena, will take us through the findings and the recommendations of this joint investigation report, shedding more light in the circumstances that surround the passing away of these healthcare professionals. This investigation was initiated in response to concerns that were raised by our Honorable Minister, Dr. Motsoaledi, the former chairperson of the Parliamentary Portfolio Committee on Health, Dr. Siyabonga Zulu, as well as widespread public concern that was captured in various platforms in the media. We recognize this release of the report as significant towards transparency, accountability, as well as building public confidence in our healthcare system. While the Health Ombud will share these findings of the investigations, let us view this engagement also as the beginning of the steps of the next phase, which would be the handing over of the report and also the monitoring of compliance and implementation of the recommendations that are contained in this report. We should all view this report not only as a series of documentation of the events that occurred, but rather a call to action. Our shared objective is to always ascertain that these findings and recommendations strengthen governance, improve the quality of health services, improve the safety of those that utilize our services, and the safety of the healthcare workers to reinforce the public confidence in the health system. So the remedy and the responsibility to remedy and to improve does not only lie with the institutions that are mentioned in the report, but it is actually a call for a coordinated and a system-wide effort. In terms of us as the OHSC, the regulatory entity, we will intensify and continue to monitor compliance with the standards for health across all facilities, and we also consider the monitoring of these recommendations not as a once-off occurrence, but an ongoing process to ensure accountability and to ascertain that the improvements are sustained. In closing, I wish to emphasize that moments of such as these present an opportunity not only to address the challenges identified, but to strengthen the foundation of our health system to be more safer, to be more responsive, and both for the users as well as the healthcare providers. Improving the health system requires partnership. It is definitely not an individual effort or an institutional effort. It requires all of us as various role players from national, provincial, oversight bodies, management teams, and healthcare workers to hold each other's hands and work together. Therefore, the report is a foundation for collective action. Ladies and gentlemen, it is then my honor to call upon Professor Taole Mokoena to give us the findings and the recommendations. Over to you, Prof.
Thank you, Dr. Ndawe. And also, thank you to the program director. Can I greet all of you? ke buele ka hare.
Sound is in video.
Oh. I should first of all recognize the chairperson of Parliamentary Portfolio Committee on Health, the Honorable Faith Mutambi. I recognize you, Honorable Minister, and I should also recognize the Vice Chairperson of the OHSC Board, Mem Kunu, and also the member of the OHSC Board, Mr. Gada. I should recognize the Chairperson of the Public Service Commission, Professor Fikeni, and also on the same breath recognize the Commissioner Yasmin Bakus and her officials that assisted us. Let me recognize the Acting Director General of Health, Professor Crisp. I recognize you, Dr. Mdaweni, as the CEO of OHSC, together with your accompanying officials. Can I further recognize the Head of Department of Health in KwaZulu-Natal, Mem Simango, together with her officials. I should also recognize the CEOs of the hospitals that we investigated. And in particular, I should recognize Mr. Kaula, the CEO of Prince Mshiyeni, who's present here among us. And indeed, recognize the chief executives of those hospitals that we visited who are not here, but hopefully are joining us online. Lastly, can I recognize the families of the officials that form the basis of this this investigation. And can I now recognize all of you here, especially the members of the media, and greet all of you and thank you for joining us here today. Before I proceed, maybe I should clarify that this report is unlike any that we've published before, and because this was not an issue of patient care or infractions of patient care, but rather the death of the carers themselves, the doctors. And it is for that reason that we have roped in the Public Service Commissioner to assist us in the investigations, particularly regarding the workplace issues that these doctors may have worked under. And I should also say that up front, that the Portfolio Committee on Health, together with the Public Service Commission, they should be seized with the recommendations that we are going to make here, to make sure that as oversight institutions, that the recommendations are being followed or implemented. Today, we released the findings of the investigation conducted by the Health Ombud into a series of deaths involving healthcare professionals in the public hospitals in KZN. Before I proceed, I should like to acknowledge the profound loss suffered by the families, friends, colleagues, and the communities that was being served by these health professionals. And I should also like to extend our sincere condolences to all those affected on behalf of the Office of the Health Ombud. These were not merely cases or statistics. There were dedicated healthcare professionals who devoted their lives to caring for others. Their death, understandably, sparked grief, concern, and public debate across the country. The questions were raised by the families, the healthcare workers, and organized labor and civil society deserve answers. Hence, this investigation. The investigation was conducted in terms of Section 81A(1) of the National Health Department, National Health Amendment Act, as well as we enlisted the Public Service Commission, as I have already said, and we are grateful for their help, especially the Natal branch of the Public Service Commission, which is led by Ms. Yasim Bakus, and leveraging on their mandate of promoting effective, efficient, and ethical public administration. We thought that it is crucial that they be part of this investigation in order to unravel any prevailing human resource practices that might have contributed to the deaths of these professionals. The professionalism, the diligence, and the commitment of the two teams to uncover the facts in no small measure contributed to the strengthening and the thoroughness, credibility, and the integrity of the investigation, whose findings we're presenting here today. The investigation was prompted by a complaint lodged independently by the Minister of Health, Dr. Motsoaledi, and the then chairperson of the Parliamentary Portfolio Committee on Health, Dr. Ronnie. At that time, there were widespread concerns about the reports of these deaths that occurred within a very short period in the KwaZulu-Natal provincial hospitals. The questions were raised about the potential impact of the working conditions, the bullying, the victimization, and workplace stresses, and broader systemic challenges in the public health system in the province. The purpose of the investigation was, therefore, not only to establish the facts surrounding the deaths, but also to determine whether there were any common factors systemic failures at the workplace together with the conduct that contributed to these deaths. The investigation examined the circumstances surrounding the deaths of these health professionals in the following hospitals: Addington, Port Shepstone, Ngwelezane, Vryheid, and Prince Mshiyeni Hospital, and Benedictine Hospital in Nongo. The investigation was conducted independently and objectively, without fear, favor, or prejudice. It comprised visits and interviews with the hospital management, the healthcare professionals, the interns, the labor representatives, together with the supporting staff. Documentary evidence, hospital records, human resource practices, employee wellness programs, and disciplinary records were reviewed within applicable legislation and regulations. Our responsibility was to establish objective facts, not influenced by the clamor that was in the public and social media platforms. The overall findings are as follows. The investigation found no evidence pointing to direct causal link between the deaths under the investigation and workplace bullying, victimization, adverse working conditions at any of the facilities concerned. However, this is an important finding because much of the public discourse pointed to workplace factors that directly cause these deaths. And this is not the finding is not to mean that the health system is free of serious challenges. On the contrary, the investigation uncovered significant systemic concerns affecting healthcare professionals across multiple health establishments. And these are that there was ongoing staff shortages, frozen vacant posts, excessive workloads, resource constraints, shortages of medical equipment and supplies, infrastructure disrepair, inadequate employee wellness support, and security concerns affecting health workers. These issues require urgent attention because they affect both the health workers and indirectly the quality of care provided to the public. Let us now look at each individual case in turn. Starting with the findings of Dr. Tumelo Kgaladi's death. The investigation found that Dr. Kgaladi, a 31-year-old male doctor, died at his residence and was not on duty at the Addington Hospital. The evidence showed that he had a history of mental health problems before he was placed at the Addington Hospital as a registrar on rotation in obstetrics and gynae department. And this fact, meaning his mental health issues, had not been disclosed to the hospital. The investigation could not establish any causal link between his death and the workplace conditions. There was circumstantial evidence suggestive of death by carbon monoxide poisoning. The final determination of the cause of death remains a subject of inquiry and inquest proceedings. However, the investigation identified staff shortages and heavy workloads in the hospital. It identified gaps in employee wellness support, medical surveillance processes, which, if they were properly undertaken, could have uncovered Dr. Kgaladi's underlying mental problems and therefore offered support and indeed management. And if that was the case, maybe the tragic death would not have occurred. The next case is that of Mr. Mvelo Cele, who was a 40-year-old male photographer who radiographer, sorry. I'm looking at these photographers here. And he died of natural causes while he was on duty at Shepstone Hospital. Autopsy report confirmed that the cause of death was cardiac arrest. The investigation found no evidence linking his death, therefore, to the workplace conditions. Nevertheless, the investigation identified significant staffing challenges at the hospital, including loss of a number of specialists and the inability to get those posts filled due to budget constraints. These challenges have implications for service delivery and staff well-being. The next case is that of Dr. Zulu. Dr. Zulu was found, the investigation found that Dr. Zulu, a 20-year-old male, was a medical doctor working in the Department of Anesthetic and Ngwelezane Hospital. And he died of motor vehicle accident at 25 kilometers from the hospital while he was off duty. On the day of the accident, Dr. Zulu was traveling with colleagues in the early hours of the morning en route from watching a soccer match in Durban. One of the colleagues survived and was able to give us account of those tragic events. There's no evidence linking this accident to workplace conditions or systemic issues within the hospital. However, the investigation identified several operational challenges at the hospital, including staff shortages, security concern, and inadequate employee wellness capacity. These matters form part of the Health Ombud's recommendations. The next case is that of Dr. Francis Idika. We found, we carefully considered the allegations that Dr. Idika, an African male who was born and trained in Nigeria, who had worked at the Freiheit Hospital for several years. The allegations were that he died of suicide as a result of workplace bullying, victimization, and undue disciplinary action. The investigation did not support these allegations. A post-mortem examination of Dr. Idaka found that he died from natural causes, from a ruptured aortic aneurysm. And he was off duty at the time, albeit within the hospital premises. The investigation found that the allegations that he had been unfairly subjected to disciplinary processes, arbitrary removal from hospital accommodation, were unsubstantiated. At the same time, the investigation identified governance failures in the handling of complaints, disciplinary matters, workplace conflicts within the hospital. These shortcomings require corrective action. The next case is that of Dr. Alulutho Mazwi. The death of Dr. Mazwi, a 25-year-old male medical intern from Prince Mshiyeni Memorial Hospital, attracted significant public media attention and sparked extensive discussion on the social media. The investigation found that Dr. Mazwi did not die while on duty. He became critically ill while at his hospital residence on the day of his death. He was rushed to the hospital emergency department where he was pronounced dead on arrival. A post-mortem examination was not carried out, but the most likely cause of his death is pulmonary embolism from deep vein thrombosis, evinced by the prodrome of unilateral lower limb swelling, shortness of breath, and raised D-dimer. Importantly, the investigation established that the social media messages alleging that Dr. Mazwi was informed by his superior that he had informed his superior that he was unwell, but was instructed to report to duty regardless, were a fabrication. The investigation found that Dr. Mazwi was known to have uncontrolled diabetes and that the support systems available to him were less than optimal. The investigation also identified concerning culture among interns at the hospital of fear to take sick leave, believing that it would extend their internship rotations or place additional work burden on their colleagues. While these factors cannot be directly linked to the death of Dr. Mazwi, they warrant serious attention. The next death is that of Dr. Ngiti. The death of Dr. Ngiti, a community service doctor from Benedictine Hospital, raised serious concerns and sparked considerable public concern. The investigation found that Dr. Ngiti died while he was off duty as a result of suicide by ingesting rat poison. The incident occurred at his rented apartment outside the hospital premises. Significantly, the investigation established that he was not directly involved in the fraudulent birth registration matter which implicated his name. We found weaknesses in the hospital's document control processes, including blank birth registration forms that have been pre-signed by doctors. This created an opportunity for abuse and ultimately led to Dr. Ngiti being being a suspect in the fraudulent birth registration that bore his signature. The investigation further found that procedural fairness was not adequately addressed in handling this matter. However, despite these findings, the investigation could not establish a direct causal link between his death and his workplace conditions. The matter concerning the fraudulent birth registration and other related criminal activities has been referred to the relevant law enforcement authorities for further inquiry. Now let's look at the systemic issues that were identified. Although the investigation did not establish direct links between workplace conditions and the these deaths under investigation, it would be remiss of us to ignore the broader concerns identified during this investigation. Healthcare professionals consistently raise concerns across several establishment investigations. These concerns include staff shortages, increased workloads, burnout, resource limitation, delays in filling critical posts, inadequate employee assistance programs, limited mental health support, workplace safety concerns, and infrastructure in a state of disrepair. The investigation also found that many employee assistance programs are under-resourced and yet are expected to support thousands of employees with minimal staffing. This is neither sufficient nor sustainable. Well-being of health workers is not a secondary issue. It is a central issue of functioning of the health service system. The system cannot effectively care for patients if it fails to adequately support those who provide the health care. And now I'm going to talk to the recommendations. The Health Ombud has made recommendations aimed at strengthening employee wellness and support programs, mental health services to health professionals, organizational culture that encourages health workers to seek help when needed, staffing and workplace planning, security measures in healthcare facilities, oversight and accountability mechanisms, and above all, compliance with prescribed norms and standards. The recommendations are also call for greater attention to workplace wellness, especially among intern doctors, community service professionals, and other junior healthcare workers operating under high-pressure environments. There is a need to improve their working conditions while recognizing the significant pressures associated with their roles. It is paramount to foster a conducive, supportive, and safe working environment. The release of this report and of many others before it does not mark the end of the process, but rather it forms part of a continuum in a journey to build and maintain a safe, responsive, quality healthcare service delivery in the Republic. In terms of the Health Ombud's mandate, the findings and the recommendations in this report will now be formally referred to the Office of the Health Standard Compliance to monitor their implication in line with the regulated norms and standards. The Office of the Health Ombud expects the affected hospitals to develop and implement practical measures to address the shortcomings identified in this report. Healthcare establishments have the responsibility not only to acknowledge these findings, but to demonstrate measurable improvements in the working environments of healthcare professionals and in the quality of care provided to healthcare users. The Office of the Health Ombud remains seized with the matter and will continue to work closely with the OHSC to ensure that the recommendations are given due effect. The ultimate objective is not merely compliance with the recommendations, but the strengthening of patient safety, staff well-being, accountability, and public confidence in the health system. The families of those who lost their loved ones, the healthcare professionals working under difficult circumstances, and the greater South African public deserve nothing less. In conclusion, I wish to reiterate that the investigation was about seeking the truth. It is about ensuring that the public's concerns were addressed with vigor and facts. It is about honoring the memory of those who lost their lives by conducting a thorough and independent investigation. The investigation identified real shortcomings within the implicated health establishment that require accountable diligence and committed leadership and sustained improvement intervention. Healthcare professionals are among the most valuable assets of our healthcare system. They deserve safe working environment with appropriate resources, adequate support, and ready access to services that protect their own physical and mental well-being. The KZN Provincial Department of Health should endeavor to mobilize adequate resources in support of these improvements. The Health Ombud, together with the OHSC, will continue to monitor compliance and to act in the best interests of both the healthcare users and the healthcare professionals. Once again, we extend our condolences to the families, friends, and colleagues of those who lost their lives. May their memory continue to inspire all of us to do our best to build a strong, safe, responsive, quality healthcare system in the Republic. Thank you very much.
Thank you so much, the Ombud, for delivering for releasing the report. We are now going to hand over the report. The Health Ombud will hand over the report to the chairperson of Parliamentary Portfolio Committee on Health, Ms. Faith Mutambi. And after that, we'll hand over to the Minister of Health, Dr. Motsoaledi. And after that, then the report will be also handed over to the OHSC board vice board chairperson, Mkunu, and also to the HOD of KZN Department of Health, Ms. Msimango.
Should we come here?
Yeah, you must come. All of you.
random order or
in that order. The first will hand over to the chairperson of the portfolio committee, and followed by
yeah, he should
and the HOD is yeah. No, thank you so much for handing over the reports. You may take your seat. Thank you so much. Thank you so much for the session, whereby the report has been officially handed over to all the affected parties. We are now moving over with our program. I'm going to invite to the podium the HOD of KZN Department of Health, Ms. Tumelo Kgaladi, to give us the remarks on behalf of the province. Thank you so much.
Thank you, Program Director. Greetings to the Honorable Minister, Dr. Motsoaledi, Professor Mokoena, Health Ombuds, Chairperson of the Portfolio Committee, Honorable Matambi, Deputy Chairperson of OHSC, Ms. Mchunu, Chairperson of the Public Service Commission, Professor Figeni, Acting DG of the National Department of Health, Professor Chris and his team, CEO of the Office of the Health Standards Compliance, Dr. Mdaweni, members of the media, colleagues, good morning. Today, the KwaZulu-Natal Department of Health formally acknowledges receipt of the Ombudsman's report into the space of death of doctors in the KZN province working for the Department of Health. CEO of the Office of the Health Standards Compliance, Dr. Mdaweni, members of the media, colleagues, good morning. Today, the KwaZulu-Natal Department of Health formally acknowledges receipt of the Ombudsman's report into the space of death of doctors in the KZN province working for the Department of Health. Firstly, I want to extend our condolences to the families that have lost their loved ones, to the relatives, and we want to say, as KZN Department of Health, the loss of one healthcare professional is one too many. And these possible premature deaths are not what we aspire to as KZN Department of Health. Our role and our motto is to preserve life and to ensure a long and healthy life for all citizens, particularly in KZN. And for all intents and purposes, we want to subscribe and to ensure that that vision is a lived experience for all of our healthcare workers. We appreciate the thorough work undertaken by the Ombudsman in examining these matters. The report represents an important step in helping us better understand the circumstances surrounding these unfortunate events and provides valuable recommendations to strengthen our system and workplace environment. The department remains committed to transparency, accountability, and the well-being of our employees. Honorable Minister and members of the Public Service Commission and the Health Ombuds, I want to commit that as a department we have already started an approach and strategy to implement the recommendations of this report as we read the draft reports as they came through, starting by assigning our director for employee health and wellness to conduct a departmental-wide organizational culture survey that focuses also on employee wellness to understand the issues that staff are confronted with at the operations level. That work is supported by the Moses Kotane Institute, which is assisting us in conducting that organizational-wide culture survey so that when we come up with the interventions for the implementation of this report, we have scientific evidence that can assist us in implementing appropriate interventions. This we are doing because we recognize that these events have had a profound impact on the affected staff members, their families, colleagues, and the broader health sector. We extend our sincere sympathy to everyone who has been affected. We will carefully study the report and its recommendations. Where shortcomings have been identified, as the Ombudsman has enumerated here, we will take the necessary corrective actions and develop an implementation plan informed by the organization-wide culture survey that we have implemented to address the recommendations within the prescribed timeframes. Part of our endeavors as well, which we have started actually working on, is to employ an appropriately skilled occupational health manager in the portfolio of a senior clinical manager that will also work with the employee wellness director to actually oversee occupational health and wellness in the workplace. In this regard, our objective is not only to respond to the findings, but also to prevent similar incidents from occurring in future. We are committed to fostering a safe, supportive, and respectful working environment for all employees. This includes strengthening governance, improving staff support systems, and reinforcing a culture of accountability throughout the department. As we proceed, we will continue to engage with all relevant stakeholders. As it has been said here that the Office of the Health Standards Compliance and the Public Service Commission will monitor our implementation of the recommendations. So we're still committing to engaging with all these stakeholders, including but not limited to organized labor, affected employees, all other oversight bodies, and our provincial leadership. We will provide updates on the implementation of the recommendations as appropriate. We thank the Ombudsman together with the National Minister for actually spearheading this work and ensuring that we have a report that we can work on in order to mitigate these incidences in the future. As much as we acknowledge that they may not have been directly related, but the indirect factors that have contributed to some of these incidences is our primary responsibility. Therefore, we are reaffirming our commitment to learning from this process in the interest of improving our health system and protecting those who serve with it, in line with our program of caring for the carer as a Department of Health. Thank you.
Thank you so much, HOD, for the remarks. Without wasting my time, I'm going to invite the OHSC Board Vice Chairperson, Memkunu, to also give us the remarks as the health regulatory body responsible for health. Thank you so much.
Program Director, Honorable Minister of Health, Dr. Motsoaledi, Chairperson of the Portfolio Committee on Health, Ms. Faith Mutambi, Chairperson of the Public Service Commission, Professor Somadoda Figeni, Commissioner Yasmin Bakus, and officials of the Public Service Commission, Head of Department of the KwaZulu-Natal Department of Health, Ms. Penelope Msimango, fellow board member of the OHSC, Mr. Gada, Chief Executive Officer of the Office of Health Standards Compliance, Dr. Sipiwe Mdaweni, Chief Executive Officers and representatives of the affected health institutions, the families of the late health professionals, members of the media, ladies and gentlemen, good morning. Today is a moment of reflection, but it's also a moment of responsibility. Today, I have the honor to formally receiving this report on behalf of the Office of Health Standards Compliance and Executive Manager therefrom. We receive it with humility, with respect for the families whose lives have forever changed, and with a clear appreciation of the responsibility that now rests with the Office of Health Standards Compliance. Before I reflect on the report, let me acknowledge the families, friends, colleagues of the health professionals whose deaths form part of this investigation. Our thoughts remain with you as we gather here today. We offer our deepest condolences. Losing a loved one can never be easy. Having to live with unanswered questions about the circumstances surrounding that loss makes the burden even heavier. While no report can take away your grief, we hope that the findings released today will provide some measure of clarity and assurance that the concerns raised were thoroughly and independently investigated. The report before us is more than a record of findings. It represents a significant undertaking in the pursuit of transparency, accountability, and institutional integrity. It demonstrates the importance of having independent mechanisms that can investigate concerns, establish facts, and make recommendations in the public interest. The findings presented today also provide insight not only into the circumstances surrounding these tragic deaths, but also in the broader challenges that continue to hinder parts of our healthcare system. The mandate of the Office of Health Standards Compliance is to protect and promote safe, quality healthcare services by monitoring and enforcing compliance with the prescribed norms and standards. As the regulator of healthcare services, our responsibility does not begin and end with receiving this report. The OHSC takes these findings very seriously, and in line with the prescribed legislation and our mandate, we will continue to monitor the implementation of measures to address the systemic concerns identified that require urgent and sustained attention. In monitoring the implementations of the recommendations, we remain guided by the principle that accountability must lead to improvement and ultimately safe and quality healthcare services. We will engage with relevant stakeholders, monitor progress, and report on compliance in line with our mandate. This process will not simply be about ticking the box, but rather about determining whether meaningful improvements are occurring in areas identified by this investigation, including employee wellness, staff challenges, governance practices, workplace safety, and compliance with the prescribed norms and standards. Healthcare professionals' well-being directly affects the quality and safety of care delivered to healthcare users. The concerns raised in this report regarding employee support, mental health services, workload pressures, and workplace conditions warrant careful attention and sustained action. The true value of any investigation lies not only in its findings, but in the actions that follow. The families who sought answers deserve action. Healthcare professionals who continue to serve in difficult circumstances deserve action. And every healthcare user deserves a healthcare system that continually strives to improve. The OHSC remains committed to working with the Office of the Health Ombud, health establishments, and all relevant stakeholders to support this objective. Let us honor the memory of the health professionals who lost their lives by ensuring that the lessons learned from this process lead to tangible and measurable improvements across the healthcare system. That is our responsibility and our commitment. Ladies and gentlemen, as the OHSC, we receive this report not as conclusion of the process, but as the beginning of our responsibility. We owe that commitment to the families who sought answers. We owe it to the healthcare professionals who continue to serve under often difficult circumstances. And above all, we owe this commitment to the very healthcare user who expects and deserves safe, quality healthcare. On behalf of the Office of Health Standards Compliance Board and its executive management, I assure the public that this responsibility will be discharged with independence, with fairness, and with the due diligence. I thank you.
Thank you so much, OHSC Board Vice Chairperson. We are now also want to make an announcement that the report is available on the Ombud website, which is www.healthombud.org.za under reports. Thank you so much. I'm now going to invite to the podium the Honorable Minister of Health, Dr. Ronnie Motsoaledi, to also give us the remarks. Over to you, Minister.
Thank you very much, Program Director. Let me state that I believe all the speakers before me have adequately presented the necessary protocols. There's no need for me to repeat again and again, but today, because for the first time when we released the Ombud report, we have two institutions, very important institutions that never attended and are attending for the first time. So let me direct my protocols to them. That is the chairperson of the Parliamentary Portfolio Committee on Health, Honorable Faith Mutambi, and the chairperson of the Public Service Commission, Professor Somato Dafikeni. The rest are family every day when this report is released. Thank you very much. At this important moment, before I reflect on the findings present, I wish to address the families and colleagues of the healthcare professionals whose unfortunate and untimely death prompted this investigation. No report, no matter how thorough it is, like this one, can fill the void left by the loss of loved ones. The pain carried by parents, spouses, children, siblings, friends and colleagues cannot be measured in findings, recommendations and statistics. It is always painful, regardless of the cause of death or who might be responsible. Hence, on behalf of the National Department of Health and on behalf of myself, I once again extend our deepest condolences to every family affected by these tragedies which nobody expected. They all confused us that a series of deaths can happen in one province, one after the other. I've been in the healthcare system for a long time. I don't exactly remember coming across something like that. It was news into us. The healthcare professionals whose lives were lost were not only employees of the healthcare system, which is what prompted us as the employer to do something, but there were sons and daughters, mothers and fathers, brothers and sisters. There were individuals who chose a profession dedicated to caring for others, often under very demanding circumstances. So we honor their memory today and will always remember them. Ladies and gentlemen, every time the Ombud is releasing a report, I want to remind the media, the public, and anybody listening why this office was established and the questions that were raised when the office was established, because there's never been a health Ombud in South Africa before. When we established it, people were asking questions, what is this? What is it going to do? And I gave them one simple answer, which I'll always repeat, that it is the public protector of health. The healthcare system needs to be protected, both the users and the officials and all the workers. And I think with all the reports released by the Ombud, that has been very clearly reflected, starting with the very, very first unfortunate report by the first health Ombud of the country, Professor Malagapuru, when he released the Life is the Main report, following by Professor Taole Mokoena. They've never disappointed. They always come up with the truth, no matter how hurtful it is. They do it without fear, without favor, and without prejudice. So the findings released today provide clarity on matters that have generated significant public concern and unfortunately in some instances also widespread speculation, innuendos, and sometimes even outright fabrications, as the report has been found. The report concludes that there is no evidence establishing a direct causal link between the death under investigation and the allegations of workplace bullying, which will have deeply, deeply worried and disturbed us, allegations of victimization or adverse working conditions. I was very worried and surprised because I personally have been an intern before. I know the conditions under which interns work and the system under which they work. It hasn't changed a lot, even though I did my internship more than 40 years ago. And you remember when we started the investigation, I said I specifically chose Professor Taole Mokoena, well, as the health Ombud, but I said it's appropriate for him because he was an intern himself. He was a registrar himself. He was a consultant himself, and he was a professor and a head of department. So he knows the system from top to bottom because he has lived it. He didn't just read about it, and he knows what should happen and what should not happen. Now, Prof, if you check all your reports in recent days, starting with I believe you had quite a number of reports, but I'll mention specifically those I remember, like the Helen Joseph report, the mental health report in Northern Cape, and the mental health report in George Mukhari Academic Hospital. All of them are pointing to four things, which we discuss every time when we meet the MEC's chairperson. Four important things, and Prof, I would have been a happier person if maybe you could have played advocate for us to mention where they emerge from. The four things, Professor Fikeni, is the issue of human resources in health. And quite a number of people believe that, well, they know that health is a concurrent function. And I was at pains, even to the president and even to members of the portfolio committee, the chairperson will remember, that there are four issues that are bedeviling a healthcare system, and they are not concurrent. They are pure provincial functions. It's the issue of human resources, is an issue of maintenance of buildings, is an issue of financial management, and lastly, issues of procurement. But we also know, Professor, without defending anybody, especially on the issue of human resources, which appear repeatedly in your report, the issues of shortage and all that. We also know, Chairperson, that's why I said I thought the professor would be our advocate. Healthcare has undergone very rough austerity over a period of 10 years. There's been austerity. We have been presenting this issue of austerity to the Ministry of Finance because it has happened over a large number of years. Austerity, austerity, austerity. And we said in the same way that corruption that happens in the public service, which we are busy fighting every day, is not a victimless crime. But I must also state that austerity is also not a victimless occurrence. It victimizes the public, especially those who use the public healthcare system. And that's why you are always having shortages. Now, this must be confronted in reality. That's why this year, Prof, let me tell you what happened. Over the years, when government sits and negotiate with unions about salaries, at the end of the negotiation period, whatever percentage is agreed on, Treasury has not been given the money. They said provinces must see to the finish because they are in charge of the human resource function. Every time they'll say, no, provinces must see to the finish. And they did see to the finish, Professor Fikeni. In what way? Over the past 10 years, they were spending money for goods and services to support human resources. And when you do that, you know what will happen. It becomes these shortages. But the human resources you are supporting are not new people, are the very same one who are working. You're just increasing their salary. And we said that system is not going to work very well. It's going to cause problems. And these are the problems we are experiencing. I know that the issues we have mentioned here, Prof, about KZN Department of Health, the Department of Education is also experiencing them. That's why we thought it was a huge achievement for a department that suffered that austerity to be #1 in the country last year. It was a huge achievement because they've gone through this. For this reason, Prof, I gave it to myself and Professor Nicholas Crisp, the acting head of department, that we visit provinces, and we've already done so, where we call the Premier, the MEC for Finance, the MEC for Health, with their HODs, and the Director General in the Premier's office. We've already sat with them. We started in the Eastern Cape to show them distance because they fall directly on their shoulders. The issue of human resources for health, maintenance of buildings, financial systems, financial management, and procurement. We started in the Eastern Cape. We then went to Northern Cape. We went to Gauteng. And we went to KZN. The issues you raise here today, Prof, we raised them in that meeting with the Premier of KZN, with the MEC for Finance, the MEC for Health, their HODs, and the Director General of the province, that these issues need to be resolved. But even with their best intentions, if austerity continues in the public healthcare system, they will always be in trouble, regardless of their understanding. I forgot to mention that we also visited Northwest, and it was a province where I was very proud to find that the Department of Health and Finance at least have got a very good and strong cooperative relationship. Whereas in the other provinces, it's a bit of the problem. They look at each other's askance, that this one is always needing a lot of money. Every time it's coming for more money and all that. But these are realities that we are faced with. We are trying ourselves to resolve them. It is for this reason, Prof, that by the end of last year, the amount of money that departments of health owed to service providers was very scary. And the chairperson knows about that. And at least we believe it was the beginning that Treasury gave a sum of 20.9 billion rand over the past 3 years to start moving away from this austerity. We don't know how long it will take, but the start has been made. We will have loved that 20.9 billion to be for 1 year, but it's unfortunately for 3 years, and we're still negotiating hard with Treasury. We really want to get out of these austerity measures because you'll always have these findings. And I won't blame health professionals for this. They are doing their best. And even your findings, Prof, prove to that. If you look at the Helen Joseph report, there were 7 complaints that were lodged against the hospital. If you look at your report, 5 were dismissed. That's not true. That this did not happen. Only 2 were upheld. And which 2 were those? Human resources and the issue of maintenance of buildings. The rest, which you dismissed, was about clinical management, meaning that our staff, doctors, nurses, etc., at least they still know and they still do the right things in managing patients. The problem are these 4 things, which were caused by austerity, which, if not resolved, we will live with them for a long time. But as I'm saying, a start has been made. Lastly, colleagues and the public, I want to report that I have appointed a team of 16 experts. One of them is the Professor Somado Tafikeni, he knows what I'm talking about, to review HR policies, which has been established from 2024, to find out what effect do they have, not 2024, 1994, sorry, from the beginning of democracy, because we are living in a different era, to find out what is the effect of these policies to some of these occurrences about shortages and all that. What policies have we put that needs to be changed? They are reviewing them, and I was expecting the first report this month of July. I don't know whether you are finalized, Prof, because it started last year. It's the policy of RWAPs, remunerative work outside the public service, whereby some very senior doctors leave the junior ones alone and go and work in the private sector, which then shines because it has got more than double the staff, because the government allowed them that in 1994. Should we still continue with the policy of RWAPs? I know it makes health professionals very angry, but I want those who are expert to view it. What does it cause here to the healthcare system if my senior, because the law allows them, leaves me to go and work in private where they already got resources, increase them and leave the juniors alone in the public service? We can't run the healthcare system without confronting that, because I know RWAPs was given to all public servants, but it has taken root in health. There's no other part of the public service where RWAPs, this remunerative work outside the public service, has taken root more than in health. I don't know of many teachers who leave their students to go and teach in a private school during school hours. It has happened in health. And unfortunately, some of the things who did so are so senior that those who are supervising them are junior to them and scared to confront them. I'm waiting for that report, Professor. The issue of RWAPs. Then the issue of committed overtime and the issue of rural allowance must also be reviewed. Lastly, it is the finding which I want to confirm, Prof, about buildings. We do have evidence that the demand of healthcare, the population, is growing much more than our facilities can carry. That is a fact. That's why this year, if you read the President's State of the Nation address, we ask him to insert it there about infrastructure. And I'm happy to announce that we have got at least 6 major projects and 5 more that will still come, which we are discussing with Treasury. And Treasury has established what is called a BFI, budget facility for infrastructure. And they've got windows, and I'm happy that the first window in which we are going to participate is this month of July, to put up any infrastructure that is more than 1 billion rand, because there's no budget of healthcare anywhere in the country or in any hospital that can afford that type of infrastructure. But it must be put up so that the population must not grow more than the infrastructure, Prof. If that happens, your reports will always reflect that. Everywhere you go, even if you are just going to investigate because somebody happened to a mental health user in a hospital, you are going to find infrastructure things. Doesn't matter where you go, you'll always find it if these problems are not corrected. And so we need very much to correct them. And we are going to sit down and look at these issues one by one to correct them. I want to give my last message to colleagues, especially in internship. The story that you are scared to ask for leave when you are sick because you won't conclude your internship is ill-founded. I don't know what is it based on. That's not the policy of government. And I don't think over the years you will know and point to many people who could not complete their internship because they fell sick. I don't remember any. Even for the past 40 years, when I did internship until now, because I've always been in the system, I don't remember that. People who don't usually complete their internship are those who committed very, very serious misconduct. Those who conclude misconduct, They are the ones who don't finish internship. And there is, of course, misconduct committed by doctors. Some of the things are nerve-wracking, if I have to tell you. I once worked with an intern, and I'm still reeling today because I'm very angry why he was still allowed to pass. Yes, he actually changed the laboratory findings of a patient because he wanted to go and sleep. Yes, the patient was in pre-diabetic coma. And when you get a patient with pre-diabetic coma, it means you're going to take blood every hour for up to 10 hours to give insulin. You won't sleep. There's no chance of sleeping. When you are an intern, sometimes you regard sleeping as a luxury, even though we know it's very necessary. And because he wanted to go and sleep, he changed the readings. And the following day, when the new team came on course, the patient was in coma. Those are very serious misconducts that can make you not conclude your internship. Not because you ask for a day off and all that. So I'm appealing to interns in all the country. You are more protected as intern than us. We did internship during apartheid. This is a democracy. It has got very serious labor laws. In fact, it's easier to be chucked out as a politician than a public servant, that you know. Yes, politicians, the president can call me after this press conference and say, goodbye, minister, you have served, thank you very well. Yes, it can happen anytime. That cannot happen to a public servant because we have got systems, because we have got the Public Service Commission, the public administration laws, you have got parliament, you have got all the areas where you can go. So I really appeal to interns. If you feel under extreme pressure and you feel that you can't make it, don't force yourself on the basis that you won't conclude your internship. That we won't allow. And I'm repeating, you only don't conclude your internship because of gross misconduct. And I've given you the ugliest of such misconducts here about what you do to patients. Why should you release you to go and touch patients if you can alter their readings? You are a killer. Then you can't go out. But why should we punish you because you are sick? We can't do that really. Thank you very much.
Thank you so much, Honorable Minister. Ladies and gentlemen, we are now going to open floor for questions, and our principals will respond to those questions. And also those who are on visual platforms, they're also welcome to also ask questions. And then when you ask a question, you must indicate, the institution that you are representing and your name. The floor is officially open. Any questions?
We have two other questions. However, they are not necessarily related to the findings of the investigation. CBC Africa. How many healthcare professionals are unemployed and have qualifications? What's the plan for employment of these healthcare professionals? That's all we have.
Yeah. Another question? Yes.
Thank you. I'm Taole Mokoena from UFM. Minister, kindly just share a bit of detail as to
From what?
UFM. Taole Mokoena.
Okay, yes.
Yeah, to the working relationship you are referring to between the provincial treasury and the health department in the Northwest, as to, in practical terms, what does that mean? And secondly, what has been the general impact of austerity on health services across the country? If you can summarize that for us. Thank you.
Do you have a question as well? No. Okay, thanks. I just want to check whether do we have any questions on the visual platforms?
There are questions incoming. We'll take them in a second.
Okay, thank you. I'm gonna hand over to the principals to respond to those questions.
I thought the questions will go to the professor. He's the one who presented the report. But now they are all falling on me. Yes. Yeah. Maybe there's something that we forgot, Prof. I can just mention. While we are very happy about the very good work of the Health Ombud with diligence, but when we promulgated the Act, we were aware that even the Health Ombud is a human being who can commit errors. We're aware. So I just want to inform you, those who may forget, in the Act we say anybody who is unsatisfied and unhappy about the findings and want to appeal, there is a mechanism. The mechanism says they must lodge appeal and say, we're not happy about this. Most of the Health Ombud report have been taken through that mechanism. And the mechanism found that they were correct. I'm happy about that. I don't remember anywhere they said no. The law says the minister must put a tribunal which must be chaired by a retired judge or a magistrate who is held by two other healthcare professionals. So they are always three. You go and present to them and say, here is the report of the Health Ombud. These are his findings about me or about which I'm not happy. And they sit down and review them. Many of you might have forgotten that after the life acid demand report, some of the people implicated were not happy and they lodged that a complaint to me. I set up a tribunal which was chaired by the former judge president of Gauteng, Judge Mamoepa, who you all hear about, is involved in quite a number of things. He was helped by a very prominent specialist like Professor Jerry, the late Professor Jerry Kovadia, who was sitting with him, and the professor of psychiatry at the University of Western Cape, because it was a psychiatric matter. They all sat and assessed, and they found that the findings of the Ombud are impeccable. Nobody can challenge them. You are aware, Prof, that your findings on the Northern Cape are all being challenged. I've been trying to set up a tribunal, and unfortunately I've not been getting retired judges. They seem to be very busy. The first one we got when you're supposed to do the job was appointed elsewhere. The second one, so I think we have got the third one now. I'm hoping the work will start. They will confirm whether the Ombud had correct findings or not. So I'm inviting you even on this one. Don't think your life is sealed if you are unhappy. You can still lodge a complaint. We will set that tribunal in terms of the law, and the people who were not involved in this, who are judges, will come and review and say, Ombud, here you are wrong and here you are right. I just thought it's important to show that. The first question from Kasi, is it Kabi BC? Yes. How many healthcare professionals are unemployed, etc.? I have been at pains to explain this thing because it's just a societal prejudice. How many engineers are employed in South Africa? How many people with BCom? Yes, how many people with BA? How many teachers are unemployed? I'm just trying to show unemployment in South Africa is a global issue. It's a problem, it's a global issue. It does not only affect health workers, but we have noticed over the years that when it's a health worker, especially a doctor who's unemployed, all hell breaks loose. Not even nurses. She's a nurse, she was the register of South African Nursing Council. Even if you have got 1 million unemployed nurses, they hardly ever get mentioned, even though they are the backbone of the healthcare system. So it's not easy to know, colleagues. It's not easy to know how many people in any one profession, including medicine, are unemployed, because this is how the system works. and I want to explain it again today. When you finish medicine, you have got to do internship. That is statutory. In other words, the state is forced statutorily to give you a job for internship because it's part of your training. You are going to do that internship for 2 years. So come dark or blue, you have got to be employed to do that internship. And that's why we've got a system which we work with universities to give us the names of every student who is doing final year so that we start placing them. And for this year, we placed them in October last year. Every medical student who studied medicine by October last year had a letter of appointment telling him to which hospital they must go and work. That's number one. When they finish that internship, they do community service, which takes 1 year. It's also statutory. It's also statutory. In fact, I forgot it when I was giving you the four the 4 HR policies that are being reviewed. One of them is community service. When it was introduced, it was because doctors were refusing to work in rural areas. We had to introduce it to push them in that direction to work in rural areas. The question is it still relevant today in today's South Africa? So it's also being reviewed, but it's statutory. Once you finish community service, the system releases you. You are looking for a job like any other person. You employ anywhere. Some go on to continue their studies in different fields. Some go to do even outside medicine like MBAs. They move all over because they are now free to get a job like any other. So it's going to be difficult for us to follow them and say, no, 1,800 doctors have finished community service and 10 of them are unemployed. We won't know. It's not easy. Some have gone into private practice. And if you then say, no, we know so many people who are unemployed, and you advertise the job for that number, even those who are in private practice who no longer want to continue, they apply and say, I don't have a job. But you find that he's running a private practice, but he no longer want to run it, maybe because he's not making it, or because it's difficult, or he realizes it's not part of his nature to go to do like that. They still want to work for the state. They apply. So for us to answer this question, it's very difficult. Even unions, if you go to ask them, they give different figures. Because we come and say, okay, they go to the media, yeah, no, so many doctors are unemployed. We say, give us the list. It's never forthcoming. It's not easy for them to come and present the list. So we can only tell you the number of interns who are unemployed, because we definitely know them, and they are not getting unemployed. But having said so, there are interns who will fully get unemployed if they believe they've been placed in an area they don't want to work at, because they usually choose Cape Town, Johannesburg, Pretoria, eThekwini, and if we are lucky, then the other towns like Bloemfontein, Gqeberha, etc. I don't even count my home place of Polokwane. Those are in the peripheries. Yes, so some prefer to sit, literally, because the intake is in January and July. Some prefer to sit for the whole 6 months and say, I'm not going to do my internship until a new space opens in July. Of course, it's because they come from well-to-do families. They don't need their salary, but they are there. But all I want to say is that no interns can be left without a job. No community health service doctor can be without a job. After that is a question that won't easily be able to answer because of the way the system works. The working relationship, oh no, I'm just talking about the, when you sit in a meeting, you can hear when two people are antagonizing each other and when they are prepared to work with each other. That's what I was talking about. Because in some places, it becomes an antagonism where you find that these people are colleagues, they're supposed to help each other, but they don't see eye to eye. So I was just emphasizing that a good working relationship also helps to solve some of these problems that we experience. Now you ask, what are the effects of austerity? Is that what you said? I've already said it. That is not a victimless occurrence. When there is austerity measures, I've told you, over the years, provinces are forced to take money for goods and services to keep people in employment or to increase their salaries, rather, not even to employ new ones. And what will happen? What will happen are the findings that the prof found: shortage of staff, equipment, etc., etc. Those will be what is found when there's austerity. And that's why we are making noise about it, because it's something that can destroy the public healthcare system. There is no austerity in private healthcare because it's very heavily subsidized. Even in February this year, Chairperson, you are aware, I did complain to the committee. When people who are on medical aids, they are, or those of us on medical aid, because I'm also one of them, yes, their tax credits were increased. At the time when we were asking for money for the public service, it was sent over to the private sector via tax credits. And that always happens. There's no place where they say, we know at the moment that the government subsidizes all the public servants on medical aid for 70 billion rand every year. You can imagine what we can do with that amount of money. We also know that anybody who's on a medical aid, their subsidy in terms of tax credit is 33 billion rand this year. And I am not going to be afraid to mention that I really wish we can have the same system as they have in Namibia, where the president just announced that starting from with herself until the last public servants, if they are sick, they must go to the public hospitals, so that they can stop some of these policies and they can see what's happening in the public hospital. So, Prof, some of the things you mentioned here, some of us know them because I took a conscious decision that when I'm sick, I'll go to the public hospitals like the other people who go there. If they must charge my medical aid, let it be. Let the money stay there and help the public. That's my choice, not because I've got anything against going to private, but this two-tier system where finances and resources are flowing to one part, which is private, which serves only 14% of the population, and the public, which serves 86%, is always lagging behind, will lead to the findings that the professor always finds in every investigation, because some of these things are not new. And that's why we want to change that type of system. Thank you very much.
Thank you so much, Honorable Minister. Can you please come up with those 3 questions on visual platform?
Calvin Kuta from SABC News. And they are directed to the Minister of Health, Dr. Motsoaledi. There is a growing concern from some residents about possible Ebola outbreak in the country. How prepared is South Africa? Can we see the country on lockdown again? Why prepare for Ebola outbreak? What led to the preparedness? That's all we have now.
Is there any other question?
No, there isn't.
No. Okay, thank you so much.
Yeah, the Minister, with your explanation of the differences between private sector and public sector, you then invited a question around NHI. What is the progress made in that regard? When can people start marching into private hospitals at the taxpayer expense?
Let me start with the last one. However, the aim of NHI is not to make people march into private hospitals. That has never been the aim at all. Because what will happen to the huge public hospitals that we have got? They are huge. And they take a large number of people. And remember, all the doctors who are in private healthcare, that's where they've trained. Their trainers are there. So we still need to continue that. The aim of NHI is that we need to pool funds for everybody, regardless of your socio-economic status, so that if there is something that you need in the private, you can go. Not that you must just march there. But if you can find something here in the public, you can also go. That's basically the aim of NHI. At the moment, the system favors the rich. I said this many times, and I remember in one meeting in the government of national unity, they were saying, no, you are talking nonsense. There are many blacks. It's not only for the rich, meaning they were telling us that it's blacks who are poor. Yes, I am black, I've got a medical aid. But the facts remain that when you look at the whole population, only 10% of the African population are on medical aids. You can go and count them and say there are so many Africans in South Africa. 10% of them are on medical aids. In the white population, 72% of them are on medical aids. So all these subsidies are accruing to them. And so while we believe there's a democracy and our system is non-racial, you can see there's a very serious racial element whereby those of a particular color are well catered for, and the majority who belongs to a different color are still in trouble. So the aim of NHI is to bring that to an end, not that people must go and march into private hospitals. Yesterday I was phoned by somebody, a colleague who said she needed to see a specialist and was given the date of the 10th of December this year. That's the only time. This is July. They say you can only go and see a specialist by the 10th, and he was asking me to intervene. Many of you think that happens only in the public sector. And of course, I refer there to a public sector hospital is going to be seen before the 10th of December. That I can assure you. And you people in the media don't believe it. So we are just saying the two systems must help each other. Coming to Ebola, yes, I can't avoid the question. It's not part of this, but South Africans are worried about it. Yes, we are worried, very worried about Ebola, especially the Bundibugyo strain, because it doesn't have any vaccine whatsoever, whereas the other strains do have a vaccine, and that's what is worrying us. Theoretically, yes, it can go to any country. So for that reason, we had to stay ready, and we are doing so. At the moment, we have got 3 committees that we have established. The first committee is chaired by Professor Crisp there. He can raise his hand. The acting Director General of the department. This is the committee that will take decisions. Once there's a breakdown of Ebola, they will meet every day, perhaps even every hour. Then the second committee is chaired by Dr. Matebula. She must also raise her hand. The DG for Hospital Services. That committee she's chairing consists of both public and private hospitals, which is what NHI want to combine. So we have selected 24 hospitals in the public sector and 12 in the private sector, where any South Africans who can get Ebola will go there. We won't allow you in any hospital because there will be chaos. These are the hospitals that we are making ready, which are preparing isolation wards, so that when you are diagnosed, and the only institution, remember, that can be able to diagnose you if you get Ebola is NICD, the National Institute of Communicable Diseases. Once NICD diagnose you, then you will choose to any one of these 24 public hospitals and 12 private hospitals. Dr. Matebula is in touch with them every day. There's another last committee, which is chaired by another DG, Dr. Anban Pile, who is not here. They are doing simulation exercises. What happens when there's Ebola from the gate? They are training. So as I'm speaking to you now, those exercises, more than 4,000 workers in the public service have already gone through those exercises. and 90 workers in the private have gone through those exercises, meaning drilling exercises of what will happen if they happen to get a patient who is infected, etc., because of the nature of this very dangerous hemorrhagic fever. Lastly, the World Health Organization, through Ministers of Health meet in Geneva every year in May, in what is called the World Health Assembly. All the policies that we say are from the World Health Organization, they are actually from Ministers of Health when they meet every year. Then they pass those policies in the form of resolutions, and the World Health Organization must implement them. In 2005, they passed what is called International Health Regulations, or IHR. The aim of international health regulations passed in 2005 by the World Health Assembly is to contain an infectious disease in one geographic area so that it doesn't spread all over. They are the ones who made the rules. Now, in terms of the international health regulations, every department of health in every country must establish a person called a focal point. That means that is the person who, whether there is an outbreak of a disease or not, that person is there and is working, is liaising with the World Health Organization to screen the environment, is talking with the others. They've got a WhatsApp group, they share. Whether you are in DRC or in South Africa, etc., people who are focal points know each other. They are also active, very active now. That is why when we had an outbreak of, not outbreak, there was no outbreak actually. When we had incidences of hantavirus, yes, all these committees came into existence immediately, they worked, and I'm sure you are aware that there's no more fear of hantavirus. We've been able to trace hundreds of people. We've observed them for 6 weeks. The focal person was in touch with them every day, checking symptoms, etc. And we no longer have hantavirus. Now at the borders, what do we at the borders? You said, should we close borders? No. We don't close borders until the World Health Organization, in terms of international health regulations, say so. Because if an individual country just panic and close borders, you're going to cause more harm and more havoc. Because health issues are not one country issue. They are global. Whatever you do affect other people, even in other countries. So up to so far, there's never been a call to close the borders. But what's happening at the borders? I'll give an example. Our biggest border here is OR Tambo International Airport. We have got what we call Port Health Authority. Port Health were people who were in the Department of Health who are working at the borders. We've now transferred them to BMA, the Border Management Authority. They report there, but we tell them what to do in terms of their everyday work. But whether they go to work or not, the Commissioner of BMA is in charge. One of the things we have asked them to do is that if a plane comes from DRC or Uganda or is related to such countries, it can't just land at OR Tambo International Airport and offload people. Immediately it lands, the Port Health people rush to the plane to start questioning the pilots, the captain and the crew. They must tell us whether they picked up anybody who seems to be unwell, who is coughing, who has developed a temperature, who seems to have gone to the toilet many times, meaning they've got diarrhea, or who's vomiting, or who complain about the headache, etc., etc. They go and ask that, so that if they found that person in the plane, that person won't move in and go to the counters. They'll find a way to take them out so that we take them to hospital to check. That's the first thing they do. The second thing is that once they're moving through the counters, we check the temperature. Last week, I went to Harare to chair a SADC Ministers of Health meeting. This issue was discussed, and one of the things which we took a resolution on is that during moments like this, Sometimes countries make a mistake by confusing political protocol with health protocol, whereby certain individuals carrying a diplomatic passport like myself, they just let them pass and say, no, head of state. We passed a resolution that during moment like this, we check every human being. Whether you are a head of state or not, if you stop, somebody say, hey, stop there, want to take your temperature, you dare not refuse, because viruses don't recognize heads of states or a health Ombud or a professor or a doctor or what. They infect everybody. So we want people to help us and be cooperative. Please subject yourself to checks, especially if you flew somewhere, so that diseases must be contained in any one part of the country. But in short, the question was from SABC. In short, we think we are ready to tackle anything that might happen. That does not mean that we are praying that Ebola must come. We're definitely praying that it should not come. But we are staying ready at the moment. Thank you very much.
Thank you, Minister. I'm now going to invite Dr. Siyabonga Zulu to give us a vote of thanks and closure. And also, I would like to announce that, we'll also afford those who want to do the media interviews after the briefing. Thank you so much.
Thank you, Program Director. Firstly, to the Chairperson of the Parliamentary Portfolio Committee on Health, Ms. Faith Mutambi, Honorable Minister of Health, Dr. Motsoaledi, Vice Chairperson of the Board of the Office of the Health Standards Compliance, Mrs. Mkunu, and also member of the board, Mr. Simpiwe Gada, to the Health Ombud, Professor Taole Mokoena, representatives of the Public Service Commission as led by the chairperson, Professor Somadoda Figeni, Acting Director General of Health, Professor Nicholas Crisp, to the chief directors, to the CEOs and officials that are joining us virtually from the affected hospitals, namely Prince Mshiyeni Memorial Hospital, Addington Hospital, Port Shepstone Hospital, Ngwelezane Hospital, Benedictine Hospital, and finally Freyhead Hospital. To the CEO of the Office of Health Standards Compliance, Dr. Simpiwe Mdaweni. To the head of department in KZN, Penelope Msimangu. To the CEO of Prince Mshiyeni, who's present here with us, Ubab Gabriel Kawula, and all the officials of the KZN department. To the families of the late healthcare professionals, the Mazwi, Kgaladi, Cele, Ngidi, Zulu, and finally Idika families. To all senior leadership of the National Department of Health, OHSC, and the Health Ombud, distinguished guests, colleagues, members of the media, ladies and gentlemen. So as we close now this event, I would like to leave you with a final reflection. A lot has been said today, but I think it's important to highlight that today's briefing was more than about the release of this investigation report. It has also been about providing answers to a lot of the questions that were posed and weighed heavily on both the families, healthcare professionals, and also to the wider public at large. It has also been about reaffirming the importance of an independent oversight and strengthening confidence in our healthcare system in South Africa. To the families of the healthcare professionals who lost their lives, we remain deeply mindful to say that no investigation can replace the presence of a loved one, nor can we ever lessen the pain that you are currently feeling. But we do hope sincerely that today's report has provided some measure of clarity and assurance to say that your concerns were heard, but also treated with the seriousness that they deserve, and that they were thoroughly and independently investigated. We continue to keep you in our thoughts. As the Health Ombud has already indicated, this conclusion of the investigation and its publication does not mark the end of the process, but rather, in accordance with the National Health Amendment Act, the reports and its recommendations have been handed over to the Office of the Health Standards Compliance so that they can be monitored in terms of their implementation in line with the OHSC's statutory responsibilities, which aim to strengthen compliance, accountability, and the quality of health services in the country. The Office of the Health Ombud remains committed to fulfilling its mandates independently, fairly, and in the best interest of the public. Every investigation undertaken by the office seeks not only to address the complaint that was raised, but also to contribute to a healthcare system that is safer, more responsive, and worthy of the trust that has been placed on the office by all those in South Africa. Finally, I wish to thank the members of the media for your continued commitment to reporting responsibly on matters of public importance. On behalf of the Health Ombud, thank you for your attendance, engagement, and participation today. Your continued interest in strengthening accountability and healthcare quality in South Africa is very valuable. This concludes today's media briefing, and I'd like to thank you all and wish you all safe travels.